Brushing and flushing of the teeth. The purpose of brushing and flushing of the teeth is first to remove the food particles from around and between the teeth. Second, to remove dental plaque. Third, to promote the client's feelings of well-being. Fourth, to prevent sores and infections from the oral tissues. And lastly, to prevent oral pathogenic microorganisms to travel to the lungs. The equipments needed in brushing and flossing the teeth are towel clean gloves, curved basin, toothbrush, cup of tepid water, dentifrice or any toothpaste, mouthwash, dental floss, and floss holder. In implementing the brushing and flushing of the teeth, first prior to performing the procedure, we need to introduce ourselves and verify the client's identity using agency protocol, and then explain to the client what we are going to do, why is it necessary, and how the patient can participate. Second is perform hand hygiene and observe other appropriate infection procedures. And lastly, provide for client privacy by drawing the curtains around the bed or by simply closing the door of the room, because some agencies provide signs indicating the needs for privacy. The rationale for this is hygiene is a personal matter.
Prepare the client. Assess the client to a sitting position in bed if health permit. If not, assess the client to a side-laying position with the head turned. For the rationale, this position prevents liquid from raining down the client's throat. Preparing the equipment. Place the towel under the client's chin. Apply the clean gloves. Use a soft brittle toothbrush, a small one for a child, and the client chose a dentifrice. Moisten the brittle of the toothbrush with uneven water and apply a toothpaste to a toothbrush. For the client who must remain in bed place or hold the curved basin under the client's chin, feed them the small curve around the chin or the neck. After that, inspect the mouth and the teeth. Open your mouth.
So now we will begin with the brushing of the teeth. So let us assume that this is my patient over here. She is sitting at the side of the bed. Then what we're going to need is we're going to need a toothbrush. So in some cases, we're going to hand the toothbrush to the client and do it herself. However, in this case, we will be the one brushing the client's teeth. So what we're going to do is we're going to hold like the brush at an angle of 45 degree, and the tips of the outer bristles of the brush should rest against and penetrate under the gingival sulcus. And make sure the brush will clean under the sulcus of 1 to 2 teeth at the same time. And the rationale for this is to, like the circular technique, what we're going to do is it removes plaque and cleans under the gingival margins. So it should be at an angle like this. Then we're gonna brush it gently. So the next step, we have to like move the bristles up and down gently in short strokes from the sulcus to the crowns of the teeth. This. So make sure we have to repeat all of the steps in the inner and outer surfaces of the teeth. and make sure that the sulky sulky of the gums have been cleaned. So we should do this on both inner and outer. Then the next thing that we're going to clean is the biting surfaces or the molars of the teeth which are inside. Then we're going to move the brush back and forth in a short strokes like this. We should do the upper part as well. Then the next step is we're going to brush the tongue gently with a toothbrush. And the rationale for this, brushing the tongue removes any bacteria, any microorganisms that's stuck, or it can also freshens the breath. So sometimes a coated tongue, can be caused by poor oral hygiene or low fluid intake. And brushing gently and carefully helps prevent any gagging and vomiting. So let us just brush the tongue. Gently. Then after that, we're going to hand the patient a cup of water or any mouthwash to rinse the mouth vigorously. So let me just put the toothbrush aside. Then after that, so for example, that the patient has already drank water, then she is gurgling or like rinsing the mouth vigorously. Then what we're going to do is, ma'am, can you please spit the water or the mouthwash in this basin? Okay, so let us assume that the patient has already spit out the water or mouthwash. So, for instance, some agencies supply a standard mouthwash, and alternatively, a mouth rinse of normal saline can be an effective cleaner and also a moisturizer. And the rationale for this is vigorous rinsing loosen and washes away any food particles that are stuck in the mouth. So the next thing is we're going to repeat all of the preceding steps until the mouth is free from any food particles and also dentifies. And the next thing that we're going to do is we're going to remove the basin, the curved basin, and help the client wipe the mouth.
Next is we're going to help our client to floss their teeth. We're going to assist the client to floss independently or floss the teeth of an alert or cooperative client as follows. So wax floss is less likely to fray than unwaxed floss. However, particles between the teeth attach more steadily or readily to unwaxed floss than waxed floss. So the next thing that we're going to do is I'm going to show you how to use the dental floss. So I'm going to zoom in the camera for you to see. So first, we'll get approximately 45 centimeters dental floss. And then what we're going to do is wrap one end of the floss around the middle finger of each hand. And then to floss the upper teeth, we'll use our thumb and index finger to stretch the floss and then move the floss up and down between the teeth. And then when the floss reaches the gum line, gently slide the floss in between the gum and the tooth and gently move the floss away from the gum with up and down motion. Next is we'll give the client tepid water or mouthwash to rinse the mouth and then a curved basin in which to spit the water. And then we'll assist the client in wiping the mouth after. Huh? All right. And then after that, we'll remove and dispose of equipment appropriately, and then we'll remove and clean the curved basin as well. Next is we will remove and discard our gloves, and then we're going to perform hand hygiene after.
Variation for clients with artificial dentures, we need to remove, clean, and inspect the dentures before returning it to the patient. And number 9, document assessment of the teeth, gums, and oral mucosa. Also include any problems such as sores, inflammation, or bleeding and swelling of the gums. Check for any agency protocol for documentation of brushing and flushing of the teeth. Providing special oral care for the unconscious or debilitated. The purpose of this is first to maintain the intactness of the health of the lips, tongue, and mucous membranes of the mouth. Second is to prevent oral infections and potential respiratory infections. And lastly, to clean and moisten the membranes of the mouth and the lips. In assessing the unconscious, first you need to inspect the lips, oral mucosa, and tongue for deviations from normal. Second is to identify the presence of any oral problems such as tooth caries, halitosis, gingivitis, and loose or broken teeth. And lastly, assess for gag reflex, ability to swallow, and ability to follow commands. The equipments we need are a clean towel, a curved basin, clean gloves, a bite block to hold the mouth open and teeth apart. We also need a toothbrush or a suction toothbrush if needed. We also need a cup of tea with water, dentifrice or denture cleaner, a tissue or a piece of gauze to remove dentures. We also need denture container as needed, mouthwash, rubber tip bulb syringe, a suction catheter with suction apparatus when aspiration is a concern, foam swabs and cleaning solution for cleaning the mucous membranes. And lastly, water-soluble lip moisturizer. Implementation. First, prior to the procedure, we need to introduce ourselves and verify the client's identity using the agency protocol. And then we need to explain to the client what we're going to do, why is it necessary, and how the patient can participate. Second is we need to perform hand hygiene and observe other appropriate infection prevention procedures. And lastly, provide for client privacy by drawing the curtains around the bed or closing the door of the room, because some agencies provide signs indicating the need for privacy. The rationale for this is hygiene is
Place the sectioning equipment nearby. For the rationale, this is a safety precaution to use for sectioning the oral cavity as needed. Place the towel under the client chin. Place the curved basin against client chin and lower cheek to receive the fluid from the mouth. And after that, apply a gloves.
Clean the teeth and brush the mouth. If the client has natural teeth, brush the teeth as described. Brush gently and carefully to avoid injuring the gums. Use a bite block if needed to hold the mouth open and teeth apart. Do not put your fingers in the client's mouth, and the rationale for this is this prevents accidental closing down on the toothbrush and biting your finger. If the client has artificial teeth, clean them as described. Moving on, we have to rinse the client's mouth by throwing about 10 ml of water or alcohol-free mouthwash into the syringe and injecting it gently into each side of the mouth. And the rationale for this is if the solution is injected with force, some of it may flow down to the client's throat and may be aspirated into the lungs. Watch carefully to make sure that all of the rinsing solution has run out of the mouth into the basin. If not, suction the fluid from the mouth, and the rationale for this is fluid remaining in the mouth may be aspirated into the lungs. Lastly, we have to repeat rinsing until the mouth is free of any dentifrice if used.
I'm going to inspect and clean the oral tissues. If the tissues appear dry or unclean, we're going to clean them with swabs or gauze and solution by following agency policy. I'm going to use a moistened foam swab to wipe the mucous membrane of one cheek. Assuming that I am one side of the mucous membrane of the cheek, the others in the tissue. Then we're going to discard the swab in a waste container. So assuming this is my waste container, and I'm going to discard the foam swab that I just used. Then I'm going to use a fresh one to clean the next area. The rationale for this is using separate applicators for each area of the mouth prevents the transfer of microorganisms from one area to another. Now I'm going to clean all mouth tissues in an ordered progression using separate applicators so then choose front of the mouth, base of the mouth, and top. Now observe the tissues closely for inflammation and dryness. So far there is no inflammation or dryness that can be seen. Now we are going to rinse the client's mouth as described in step 1. So now I'm going to move to the next step, which is to ensure client comfort. Rinse in and dry around the client's mouth with I only have assuming this is a towel, then dry the client's mouth. Then you can replace artificial dentures if indicated. Now you're going to lubricate client's lips with water-soluble moisturizer. The rationale for this is to prevent cracking or any subsequent infection or dryness. So this is my water-soluble moisturizer. Assuming this is the moisturizer. Next, we're going to remove and discard gloves. Then perform hand hygiene.
Is a personal matter. Number 8 is document assessment of the teeth, tongue, gums, and oral mucosa. Include any problems such as sores or inflammations and swelling of the gums. Evaluation. Consider the client's medical diagnosis and treatments, like chemotherapy or oxygen, and the necessary nursing interventions related to the oral hygiene. And lastly, conduct an ongoing assessment, if appropriate, of the oral mucosa, gums, tongue, and lips.
Okay, so for the purpose, first to stimulate the blood circulation to the scalp, Next, to distribute hair oils and provide a healthy sheen. So next, to increase the client's comfort. And then lastly, to assess or monitor hair or scalp problems like matted hair or dandruff. So for the assessment, history of the following conditions or therapies like recent chemotherapy, hypothyroidism, radiation of the head, unexplained hair loss, and growth of excessive body hair. So next, usual hair care practices and routinely used hair care practice like hairspray, shampoo, conditioners, hair oil preparation, hair dye, curling or straightening preparations. So next, whether wetting the hair will make it easier or difficult to comb. So kinky hair is easier to comb when wet and very difficult to comb when dry. So next, condition of the hair and scalp. Is the hair straight, curly, kinky? Is the hair matted or tangled? Is the scalp dry? So next, evenness of hair growth over the scalp. In particular, any patchy loss of hair, hair texture, oiliness, thickness or thinness, presence of lesions, infections or infestations on the scalp, presence of hirsutism. Then lastly, self-care abilities. So for the planning, the equipments that we are going to be using, first, clean brush and comb, towel, and then lastly, hair oil preparation if appropriate. So for the implementation, first, prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how to participate. So second, perform hand hygiene and observe other appropriate infection prevention procedures. Third, provide for client privacy by drawing the curtains around it or closing the door to the room. So some agencies provide signs indicating the need for privacy. The rationale for this is hygiene is a personal matter.
So for our next step is we need to position and prepare our client appropriately. Starting off is we need to assist the client who can sit to move into a chair. The rationale for this step is hair is more easily brushed and also combed when the client is in a sitting position. And right here, my client is already sitting in a comfortable chair, which I already provided earlier. Meanwhile, if health persists, we need to assist the client confined to a bed to also prepare into a sitting position. We may do this by raising the head of the bed. But otherwise, we need to assist the client to an alternate side-lying positions and make sure to do this one side at a time. Furthermore, if our client remains in the bed, we may want to consider to place a towel over the pillows at the client's shoulders and then make sure to place it over the sitting client's shoulders. And the rationale for this step is the towel that we will provide may collect any removed hair, dirt, and also any scaly materials in the position of our patient. And lastly is we also need to make sure that there are no pins or any ribbons attached in the hair of our patient. But if so, we may want to remove it prior to our procedure. And now as we can see, there is no pins or ribbons that is attached to the hair of my patient. So moving on to the next step is we need to remove any mats or tangles in the hair of our patient gradually. Starting off is the mats can usually be pulled apart with our fingers only, or we may also do it or work out with a repeated brushings. But remember, if the hair is very tangled, we may want to consider using an alcohol or any oil such as a mineral oil and use it on the strands to help loosen the tangles in the hair of our patient. Then we also need to come out in a small section of the hair towards the ends of the hair of our patient. We may do this by stabilizing the hair with our one hand, and then our one hand touching the comb will pull out the hair from the middle down to the ends. And the rationale for this step is this will avoid our patient from having a scalp trauma. Okay, so for our next step is we need to brush and comb the hair of our patient. By doing this if our patient have a short hair, we just need to brush and comb the hair of our patient one side at a time. By doing this we need to divide the hair of our patient into two sections by parting it Parting it down, it's starting off with the middle and then the front of our patient down to the back. And make sure if the hair of our patient is thick, you may want to divide it each sections into a front and back subcutaneous, or we may also do a several layers from brushing the hair of our patient. Okay, so next is after brushing and combing the hair of our patient, we also need to arrange the hair as neatly and as attractively as possible. And make sure to do this accordingly to the individual's desire. Optionally, braiding the hair is allowed because braiding hair can help prevent any tangles into the hair of our patient. But this is only optional. We can do this if the clients have a short hair or also a long hair. Then lastly is make sure to document the assessments and also the special nursing interventions. Take note that a daily combing and brushing of the hair are not normally recorded into this assessment. Okay, next for our variation, this pertains to the hair care for individuals with natural or thick curly hair. The first thing that we need to do is we need to position our client and prepare just like earlier. By doing this is we just need to separate the hair into the 4 sections just like what I've mentioned earlier. Then we need to proceed from one section to the next. We just need to do this one by one. Then the next is we need to untangle the hair first if appropriate. By doing this, it's just like what I said, we just need to use our hands and in removing the tangling of the hair of our client or using a continuous brushing. Next is we also need to comb the hair of our patient by dampen the hair with any water or leave in with a conditioner for a few minutes. And the rationale for this step or for applying a conditioner or water, this will help to loosen any tangles in the hair of our patient. Then we need to apply a hair oil preparation as the client indicates or preferably by our client. We may want to do this by using a large open fluted comb or the large spaces comb and just grasp the small section of the hair by holding the hair at the tip of it and start untangling the tip and work down towards the scalp of our patient carefully and slowly only. And lastly is we just need to ask our client if he or she would like the hair braided. Just like what I've mentioned earlier, having a braided hair may minimize or may reduce the tangling on the hair of our patient.
So for the evaluation, conduct ongoing assessments for problems such as dandruff, alopecia, pediculosis, scalp lesions, or excessive dryness or matting. So lastly, evaluate effectiveness of medication if appropriate.
Bathing a client. So the purpose of this is to remove transient microorganisms, body secretions and excretions, and dead skin cells. Also, to stimulate circulation of the skin, to promote a sense of well-being, to produce relaxation and comfort, and lastly, to prevent and eliminate unpleasant body odors. In the assessment phase, we need to assess physical or emotional factors such as fatigue, sensitivity to cold, anxiety, or fear. We also need to assess for the conditions of the skin, including its color, texture, turgor, presence of pigmented spots, temperature, lesions, abrasions, and bruises. We also need to assess for the areas of erythema or redness on the sacrum, while bony prominences and heels should be assessed for possible pressure ulcers. We also need to assess for the presence of pain and need for additional measures such as analgesic before the bath. We also need to assess for the client's range of motion of the joints and other aspects of health that may affect the client's bathing, such as their mobility, strength, and cognition. There's also a need to assess for the use of clean gloves during the bath and clients' fall risk who wish to shower. Lastly, some clients may have body piercings. We must ask the client what hygienic measures are needed to care for their piercings. For the equipments, we need to prepare basin or sink with warm water and the temperature should be 43 degrees Celsius and 46 degrees Celsius. We must also prepare soap dish, linens, which includes the bath blanket, bath towel, and washcloths as determined by the client's need, clean gown or pajamas or clothes as needed, and additional bed linen and towels if it is required. We must also prepare clean gloves if appropriate, and if there is a presence of body fluids or open lesions. We must also prepare personal hygiene articles such as deodorants and lotions, shaving equipment, and we must also prepare table for bathing equipment and bag for the salt linens. For the preparation stage of the implementation phase, prior to performing the procedure, we must introduce ourselves and verify the client's identity according to the agency protocol. We must also explain to the client what they're about to do, why is it necessary, and how can the client participate. We must also discuss with the client his or her preferences for bathing and explain any unfamiliar procedures if there is any. Next, we must perform hand hygiene and observe other appropriate infection control procedures. After that, we must provide for client privacy by drawing the curtains around the bed or closing the door of the room. The rationale behind this is hygiene is a personal matter. Continuing the preparation stage, we must prepare the client and the environment. We must invite a family member or significant other to participate if it is requested by the client. We must also close windows and doors to ensure that the room is in a comfortable temperature. The rationale behind this is recurrence, increased loss of heat from the body by convection. Next, we must offer the client a bedpan or urinal or ask whether the client wishes to use the toilet or commode. The rationale behind this is warm water and activity can stimulate the need to void. The client will be more comfortable after voiding, and voiding before cleaning the perineum is advisable. Next, we must encourage the client to perform as much as personal self-care as possible. The rationale behind this is this promotes independence, exercise, and self-esteem.
Hi, good day. So what we are going to do is to prepare the bed and position the client appropriately. But first, we need to position the bed at a comfortable working height, and next is to lower the side rails on the side close to you and make sure to keep the other side rail up. Assuming that both side rails are in place, I will now assist the client to move near me. Okay. So the rationale for this is to avoid undue reaching and straining and promotes good body mechanics. It also ensures the client's safety. Let us now proceed in placing the bath blanket over the top sheet. Remove the top sheet under the bath blanket by starting at the client's shoulder and moving the linen down toward client's feet. We will then ask the client to grasp and hold the top of the bath blanket while pulling the linen to the foot of the bed. Can you please hold the top sheet for me? So the rationale for this is the bath blanket provides comfort, warmth, and privacy. And also, please do note that if the bed linen is to be reused, make sure to place it over to the bedside chair. If it also to be changed, place it in the linen hamper, not on the floor. Now, what we'll be doing is we'll be removing the client's gown while keeping the client covered with a bath blanket. After removing the client's gown, place the gown on the linen hamper. Lastly, we will make a bath mitt with the washcloth. So the rationale for this is a bath mitt retains water and heat better than a cloth loosely held and prevents end of washcloths from dragging across the skin. And that would be all. Thank you.
Okay, ma'am, for the next step, we are going to wash your face. So, ma'am, for the rationale of this is to begin the bath at the cleanest area and work downward toward the feet. So, ma'am, the next thing I need to do is to remove your pillow, okay, and put towel under your head. Okay, ma'am. So, ma'am, I'm going to wash your eyes. Is that okay with you?
Yes.
Alright. In washing your eyes, ma'am, make sure that you will use the cloth side by side to prevent microorganisms. So, from inner and to outer canthus. So, the rationale of this is using separate corners prevents microorganisms, transmitting microorganisms from one eye to other eye. So, wipe from the inner to the outer canthus, ma'am. So, ma'am, after that, you want me to use soap on your face?
No.
Alright. So, in this part, I'm going to use water. And, okay, wash your face. From your forehead, your nose. Then next, from your ears, your one ear and your another ear. Then, lastly, your neck. Okay? So, the rationale of this, the rationale of using soap is, this is the soap has a drying effect, and the face which is exposed to the air more than the other body parts. So this is tends to be drier. So, ma'am, after that I will wash, rinse and dry the client's face, ears, and necks, ma'am. No, for the next, I need to dry your face, ma'am, and your neck. And the last thing you need to do, ma'am, is to remove your towel on your head.
Next, wash the arms and the hands. So, place a towel lengthwise under the arm away from you. The rationale behind this is that it prevents the bed from becoming wet. And then we will wash, rinse, and dry the hands and arms by elevating the client's arms and supporting the client's wrist and elbow. So we will use a long-term stroke from the wrist to the shoulder, including the axillary areas. The rationale behind this is that firm strokes from the distal to the proximal areas promote circulation by increasing the venous blood return. And of course, we must not forget to wear gloves if needed. Next, apply deodorant or powder if desired. So, special precaution or special caution is needed for clients with respiratory alterations. The rationale behind this is that powder is not recommended with this patient due to the potential respiratory adverse effect. Next, this is optional but we can again place
a towel on the bed and we will put the basin on it, and then we will place the patient's hand on the basin. The rationale behind this is that many patients enjoy immersing their hands in the basin and washing themselves. And soaking loosens the dirt under the patient's nails. And we will also assist the client in washing, rinsing, and drying their hands. And we have to pay attention to the spaces between the fingers. And then repeat the procedures to the arm and the hands nearest you, and exercise motion if an IV infusion is present, and check its flow after moving the arm. And avoid submersing the IV site if the dressing is not clear or transparent dressing. So the rationale behind this is that clear transparent dressing will keep the water from the IV site. However, a viscous dressing becomes contaminated when becomes wet with the water.
Wash the chest and abdomen. Omit the chest and abdomen for a partial bath. However, the areas under a woman's breast may require bathing if this area is irritated or if the client has significant perspiration under the breast. Place the bath towel lengthwise over the chest. Fold the bath blanket down to the client's pubic area. Rationale: keeps the client warm while preventing unnecessary exposure of the chest. Replace the bath blanket when the areas have been dried.
Wash legs and feet. Omit the client's leg for partial bath. To begin, we're going to expose the client's leg by folding the blanket toward the other leg. We need to be careful, ensuring that the perineum is covered. This is to promote privacy and maintain dignity. Next, we're going to apply the bath towel under the client's leg lengthwise. So we're going to carefully lift the client's leg and apply the bath towel. Washing the legs from the proximal to the distal promotes circulation by stimulating the venous blood flow. Next, we're going to wash the feet by placing it to the basin. So we're going to leave it for about a minute. Next, we're going to dry the legs using a dry towel. So first, we're going to dry the feet. So we're going to carefully remove the feet from the basin. And remove the basin and put it over the bedside table or chair. Use another towel to dry the legs. Next, we're going to remove the bath towel. I'm going to carefully lift the client's leg. And again, we're going to cover the client's legs. We're going to repeat the same procedure to the other side.
Obtain fresh warm bath water now or when necessary. Water may become dirty or cold. Because surface skin cells are removed with washing, the bath water from dark-skinned clients may be dark. However, this does not mean that the client is dirty.
Wash the back and then the perineum. Assist the client into a prone position or a sideline position far away from you. Then, place the bath blanket or bath towel lengthwise alongside the back and buttocks while securing while securing or while keeping the client covered with a bath blanket as much as possible. The rationale for this is this provides warmth and prevents undue exposure. Okay, sir, I'm going to position you po into a sideline position. Let me po. Okay. Now, putting the back blanket and back towel lengthwise, exposing the back and the buttocks of the client. I'm also having an additional pillows for additional secure for the client. Wash and dry the client's back, moving from the shoulders to the buttocks and upper thighs, paying attention to the gluteal folds. Then discard to the appropriate trash bin. Next, remove and discard the gloves if used. Into the appropriate trash bin. Then perform a back massage now or after the completion of the bath. I'm going to do it now. Assist the client into a supine position and then determine whether the client was able to wash his or her perineal area independently. If the client cannot do so, drape the client as shown and wash the area. Let's assume that the client is not able to wash his or her perineal area independently, so we are going to wash it. Okay, wearing again clean gloves. Okay, position point, face the position. Then bring the client. Now, using hot towel, soak in water. Then dry, take a hot towel, tissue. Then discard. Assist the client with grooming aids such as powder, lotion, or deodorant. Use powder sparingly. Do not shake directly onto the client. Put it in hands and lightly dust skin. Release as little as possible into the atmosphere. The rationale is this will avoid irritation of the respiratory tract by powder inhalation. Excessive powder can cause caking, which leads to skin irritation. Now, help the client put on a clean gown or a pajama. Assist the client to care for mouth, hair, and nails. Some patient or client prefer or need mouth care prior to the bath. But in this case, we're going to do it after the bath.
For the tub bath or shower variation, first we need to prepare the client in the tub. We fill the tub about 1/3 to 1/2 full of water, which is 43 degrees Celsius to 46 degrees Celsius. The rationale behind this is sufficient water is needed to cover the perineal area. Next, we cover all IV catheters or wound dressings with plastic coverings, and we instruct the client to prevent wetting these areas if possible. We also put a rubber bath mat or towel on the floor of the tub if safety strips are not on the tub floor to prevent slippage of the client during bath or shower. Next, we assist the client into the shower or tub. We assist the client taking a standing shower with the initial adjustment of the water temperature and water flow pressure if it is needed. Some clients need a chair to sit on in the shower because of their weakness. Next, we also need to explain to the client how the client signal works. After that, we place an occupied sign on the door. For safety reasons, we should not leave the client with decreased condition or clients who may be at risk. We assist the client with washing and getting out of the tub. We wash the client's back, lower legs, and feet if necessary. We also assist the client out of the tub. If the client is unsteady, we place a bath towel over the client's shoulders and drain the tub of water before the client attempts to get out of it. The rationale behind this, draining the water first lessens the likelihood of a fall, while the towel prevents the client from chilling. After that, we need to dry the client and assist with follow-up care. We assist the client back to his or her bed and clean the tub or shower in accordance with the agency practice. We discard the used linen in the laundry hamper. We place the unoccupied sign on the door and we document necessary information. For the evaluation phase, we need to note the client's tolerance of the procedure, such as respiratory and pulse rate, behaviors of acceptance or resistance, and statements regarding comfort. We also need to conduct appropriate follow-up, such as determining condition and integrity of skin, including dryness, redness, lesions, and so on. For client strength, we need to note the range of motion and circulation, also the client's movement and sensation for all the client's extremities. We also need to note the percentage of bath done without the assistance of the nurse. We compare this to the prior assessment data if it is available.